Hi, everybody, and welcome to today's webinar on guidance for intersectionality, which is hosted by the Collaborative on Citizen Data. The Collaborative is a global multi-stakeholder initiative that brings together national governments, civil society organizations, international organizations, researchers, academia, and in general, various groups of data practitioners. These groups and communities and organizations, I'm sure, are well represented here today among our participants. Thank you so much for joining us. My name is Francesca Perucci, and I'm from Open Data Watch. I'm very pleased to be moderating today's discussion on behalf of the Collaborative. The Collaborative was established by the UN Statistical Commission in 2023 with the main goal of strengthening the production and responsible use of citizen data for decision-making overall and to inform policy and action, while at the same time addressing critical questions around data quality, governance, ethics, trust, and inclusion. So in 3 years, it has done a lot of work. It has succeeded in elevating the role of citizen data in shaping more inclusive and people-centered data systems. And it's created various working groups and various work streams. It is co-chaired by the UN Statistics Division and Open Data Watch, and is guided by a very diverse steering committee, 10 different organizations, and powered by a rapidly growing global membership. The work program of the Collaborative over the last year has focused on developing a series of guidance resources on citizen data to support their production and use, all done in line with the Copenhagen Framework on Citizen Data and its principles. And I hope most of you know the Copenhagen Framework is what guides our work, is the framework that puts together, all the different ideas and the definition of citizen data and principles. One of such resources, we have 7 work streams, is the guidance on intersectionality, which is the focus of today's conversation. And in a moment, you will hear from my colleague Elizabeth Lockwood what the guidance is about. So why did we choose to cover intersectionality as one of the work streams of the Collaborative? In a data context, intersectionality really helps us move beyond the simple averages and simple disaggregations and really look at how data systems can capture the complexity of people's lives, recognizing that the lived experiences and inequalities are shaped by multiple and often overlapping identities. And citizen data are, of course, a key source of data for intersectionality, and they offer key insights into how these overlapping identities can shape the lived experiences of people. And so citizen data are really uniquely positioned to advance intersectionality in data systems. So the document that we'll be looking at today and having a conversation about is the result of the collaboration of members and partners of the Collaborative, but also benefited from inputs and case studies from various organizations. We have an excellent list of speakers today who will help us explore the topics that we cover in the guidance. We also have intentionally reserved a substantial portion of the agenda for discussion and exchange. We really need to hear from you and have your inputs to continue to advance the work in this area, to learn from your experiences in various parts of the world, and also expand the network of experts that can help us enrich the guidance materials and the tools that we want to use to make the current data systems more inclusive. Before we begin, the usual few housekeeping items. The webinar is being recorded, and the recording will be shared after the event. International sign interpretation and real-time captioning are available throughout the session. A link to the live human English captioning has also been shared in the Q&As. And please use the Q&As function to submit questions for the discussion portion. We'll be monitoring those throughout the event. Also, you will not be able to type into the chat, so please use the Q&As the Q&A box to also note if you're having trouble. So if you have any issue on which you need some assistance, and our team will be happy to help you. So I'm now pleased to introduce Elizabeth Lockwood, representative of the CBM Global Disability Inclusion at the United Nations, who will provide a high-level overview of the guidance. Elizabeth is also one of the authors of the guidance. And Elizabeth, you have the floor. Over to you.
Thank you, Francesca. I'm very pleased to be here, and I'm representing also the stakeholder group of persons with disabilities. We are one of the co-leads, along with Francesca and Open Data Watch, of this intersectionality guidance. So we really appreciate you being here, and we really welcome your feedback to make this the best document that we can. Francesca already touched on this, but I just want to also mention that the collaborative is a multi-stakeholder initiative. So it's not only the United Nations, but also civil society and research institutions and human rights institutes. So we have a variety of different perspectives, and that's something that we really want to bring in this guidance. Intersectionality, of course, is a concept that recognizes people's experiences are shaped by multiple and intersecting identities. And this includes race, ethnicity, class, gender, age, disability, migrant status, sexual orientation, and others. Intersectionality comes from the tradition of Black feminist legal theory, and the term was originally defined by Kimberly Crenshaw. But we are looking to build on this wonderful foundation, looking at data intersectionality, which is based on the concept and is an approach to data and data analysis that offers a better understanding of how multiple social identities interact and influence a person's experiences and outcomes. It highlights disparities that may otherwise be hidden if we're only looking at one single dimension of identity. Within this guidance document, we introduce the intersectionality approach through the data lens, and we really wanted to bring in experiences from partners, and you'll hear from them later. It also offers a practical guide on how citizen data, because that is the focus of our work, citizen data, and other data sources can be used to inform intersectional data analysis. And this is really important to represent the lived experience of persons, especially underrepresented persons and communities. We include case studies, which I think are really the beauty of this guidance. They're at the last section that you can see in the Google Doc on how intersectional data was used. We look throughout the data value chain, so collection, publication, uptake, and impact of data using Open Data Watch's framework, the Intersectionality Data Framework, as a structure. We address data sources for intersectionality, including intersectional approaches and household surveys, citizen data for intersectionality, qualitative data, which Kate will talk about later, and mixed methods. Talking about the timeline and next steps, we started this important work last year in March, and we reviewed case studies to start to understand the relationship between citizen data and intersectionality. And we worked with Kate to understand an in-depth look at qualitative data around this. We've shared a final draft with the collaborative, with the steering committee, and now we would like your feedback. If you could share in your points and suggestions in the Google Doc by the end of February, we would be very pleased. And as next steps, we will ensure that the document is fully accessible for persons with disabilities, and we plan to develop training tools based on the guidance, present in relevant events, and we will publish the guidance on the collaborative's website and then implement the guidance note and training tools. So I will finish here and I will hand it back to Francesca. Thank you, and please let us know if you have any questions.
Thank you so much, Elizabeth. And of course, you'll have a chance to ask questions, more detailed questions on what Elizabeth presented. And we have, as I said earlier, quite a bit of time for the discussion later. So now I'm turning to Kate Caldwell. Hi, Kate. Kate Caldwell is the Director of Research and Policy at UCLA School of Law. And she will talk about the role of citizen and qualitative data, in particular in advancing intersectional analysis. Kate is also the author of two excellent reports on qualitative data that are much more extensive and cover qualitative data much more extensively than what we do in the guidance. They just inform that chapter on qualitative data there. So hopefully those will also be made available to the community soon. Kate, the floor is yours. Over to you.
Oh, thank you so much. Let me just share my screen because I do have a PowerPoint. And it has some nice visualizations on it, but I will be saying everything that's written on the PowerPoint. And there's alt text if anyone has the electronic version. So I want to sort of piggyback off of what Elizabeth just said. And I'm going to be talking about intersectionality and qualitative data. I am the Director of Research and Policy for the Center for Racial and Disability Justice. And my opening slide shows a field of golden poppies on a blue background to celebrate our center's move to UCLA Law, which we're very excited about. But also, I want to start by reiterating that, when we are talking about intersectionality, we need to start by understanding that it does come from the tradition of Black feminist legal theory, in particular, Kimberly Crenshaw's work, and what that means exactly, especially within the frame of a human rights approach. And at its core, intersectionality has always been about the limits of rights frameworks. And others have certainly built on this over the years and developed it in a variety of different ways. But we've also seen a lot of people use the rhetoric, the language of intersectionality without actually meaningfully engaging with its intended purpose. And so people will say, oh, we're being intersectional, but they're not actually doing anything that meaningfully changes the structures or power dynamics. So what exactly does any of that mean? At the end of the day, we don't all experience the world the same. And we certainly don't all experience the law the same. The law doesn't apply to all of us equally, even though it's supposed to. And part of the reason why is because law wasn't created for all of us. It was created for white, non-disabled, cishet men. And so we've seen the law treat people unequally. Right. And but we are all holding multiple identity statuses, right? We are not just men and women. We are, we are coming from different positionalities in the world based on our race and our class and our gender identity and our sexual orientation and our disability identity and all these various different things. And also those identities are not monolithic. Those identities are complex. And the intersections of those identities and how they express themselves in the world are complex. And the way that we interact with power systems, such as the law, such as rights-based frameworks, such as a number of different things, and how is also complex. And so when we talk about data, we're talking about how do you collect data that's going to accurately reflect these complexities, right? And so at the end of the day, that's sort of what we're talking about here. And so intersectionality, it's not just a theory. You can't stop there. It's actually a critique of how rights regimes define legal subjects and recognize harm and design remedies. And at its core, that's what policy is attempting to do, right? And so when you think about human rights, they were developed initially around these single axis categories and treaty silos. And what that did was it fragmented this complex lived experience into manageable categories, or rather categories to be managed. And the structure, that very structure, ends up creating or perpetuating these same systems that Crenshaw was originally critiquing in her work, right? And so that comes to the discussion that we're having today and the work that the Collaborative on Citizen Data is doing here by identifying intersectionality as a core component of the work that they're doing. Because intersectionality is basically a method of interpreting rights. It exposes how these rights frameworks are structured around single access categories. It exposes how rights frameworks structured around single access categories systematically can misrecognize and underprotect people whose lives are shaped by these interlocking systems of power. And by doing intersectional analysis, by using intersectional methods, by collecting data, by everything we're going to talk about for the rest of this webinar, what we're trying to do is not just critique those power dynamics and relationships, but actually talk about how we can use data to try and confront and untangle them. So the question before us then is, how do we engage meaningfully with intersectionality when we're working with citizen data? So that's a big buildup to my first slide. Which is when we're doing data justice, it must be intersectional. And in doing data justice intersectionally, it allows us to reveal how these overlapping systems of oppression shape inequities in data, as well as algorithms and data governance. And it is essential for ensuring fairness, equity, and accountability in citizen data systems, but also very importantly, in the decision-making processes. And in doing so, it's very, and perhaps more importantly, when we're looking specifically at data, intersectionality is necessary to ensure that our data is actually going to be representative, so that it's going to be reflective of the lived experiences of the people that we're trying to count, right? Because, you know, data at the end of the day is not just about counting people, it's about making sure that people count, making sure that they're not being neglected, overlooked, oppressed, and suppressed in some way. And so that brings me to the next point, which is that intersectional data helps to reflect and center those that are going to be most impacted. Because at the end of the day, any policy decision that we make is going to disproportionately impact people who are multiply marginalized. And we'll come back to this again. So intersectionality is not simply about disaggregating a variable or two, right? That's certainly part of it, but it's a very small part of what being intersectional is. Rather, it's a pattern of interlocking oppressions, and qualitative data allows us to see those patterns quite clearly. Now, I also want to be clear that there are intersectional methods for both quantitative and qualitative data. However, qualitative data does lend itself naturally to intersectional methods because it allows for rich context to be incorporated, not just allows for, but requires rich context to be incorporated in the analysis, whereas with intersectional quantitative methods, effort needs to be made to ensure that it's going to allow for intersectional data collection, and that's going to allow for intersectional analysis later on. And that brings me to my second point, which is that intersectionality isn't something that you do at one point in the data process or in the data chain. It's something that needs to be incorporated at every single step throughout, from the very identification of the problem or need in the community, through the design, through the data collection, the how you decide what data you're going to collect and why, through the analysis, and and also ensuring that you're going to collect data in a way that is actually going to allow for intersectional analysis, because that's not always a given, but also in how that data is going to be disaggregated or disseminated, how that data is going to be used. Intersectionality is something that needs to be intentionally and meaningfully engaged with at every single point. So what then are the benefits and drawbacks of intersectional citizen data. The benefits are, it helps to reveal these hidden inequities in citizen data. It also helps to center marginalized voices, particularly for policy design and policy decisions. And so anytime that that a population is marginalized, we need to make an effort to center them, again, in the research process or in the data collection process. Sorry, I'm a researcher, so sometimes I say research, but a lot of these are transferable skills. But so you need to make an effort to center people whose voices have been ignored, overlooked, neglected, whose needs aren't being met in the community, so that you can actually design policy that's going to address the needs of the entire community, not just those whose needs are already being met, right? It also helps to inform fair design and to reduce bias, and it helps to enhance transparency and accountability. In particular, intersectionality calls attention to these power relations in data governance, demanding participatory and community-led approaches to how citizen data is collected, categorized, and then used. Some of the concerns that we see in how intersectionality is sometimes used includes what we talked about just a little bit ago, which is something called theoretical dilution, or the use of the rhetoric of intersectionality without actually meaningfully engaging with it. Another concern would be reductionism. So that's the oversimplifying of lived complexity of intersectionality, which risks reducing intersectionality to simply and looking at interaction effects between variables, for example, which strips it of its critical roots necessary to understand the context within which these interactions are happening. Another concern is tokenism. So it may tokenize marginalized participants by overemphasizing simple or superficial identity categories rather than seeing looking at the products of these relational power structures that are impacting people from those identity categories or the intersection of identity categories. So in data, this can look like, looking at individual variables rather than looking at the structures within which those variables are happening. That can actually tokenize individuals. We also see a concern around the misuse of data. And this is something that is particularly top of mind given current events in the world today. And this is where intersectional citizen data can be weaponized by surveillance states and that would expose marginalized communities to harm. And so there is the concern around that as well. Another concern would be around the complexity and interpretive ambiguity of intersectional citizen data. So, for example, policymakers could potentially misuse intersectional findings due to their complexity or oversimplify them for convenience. So one example of this would be, and I'm sure a lot of you, if you're listening to this, you care about data and how data is used. And so one thing that qualitative researchers see a lot is the quantification of qualitative data. So one example here would be if you were to take intersectional data, qualitative data, and then quantify it so that you can show something like a demographic table. That doesn't show anything about the experiences of the individuals. It's really more sort of a extractive surveillance-y type of way to show who you were talking to. It's not intersectional because it doesn't actually engage with anything about those numbers that have been extracted from that qualitative data. You see what I'm saying? And so it's a misuse of the data because it's taking a rich data set and then trying to simplify it down into an easy to understand table. Now, knowledge translation is all about taking complex data and making it easy to understand and use in one's daily life, but that's not knowledge translation. That would be more this misuse or oversimplification of the data. Another concern that we often see is around data ethics and structural bias. And that is that it can reproduce systemic inequities if it's not paired with community-based and participatory approaches. And that's part of the reason why we see such a wonderful fit between intersectional methods and approaches, particularly when we're looking at citizen data. And then finally, one of the most critical concerns involves positionality and reflexivity. So positionality has to do with how we position ourselves relative to the research we're doing or the data we're collecting. And then, and also how we position ourselves in the world. And reflexivity has to do with sort of our awareness of our positionality relative to the data and the context within which that data is being collected. And so if we are aware of and understand the context within which we are collecting that data, as well as our own position relative to the data, that allows us to more responsibly and ethically collect good data that accurately reflects the lived experiences of the people whose unmet needs we're trying to meet, without necessarily allowing for bias or any of these other concerns to introduce themselves somewhere in the process. Without reflective practices, however, we risk reproducing all of those power imbalances that existed before. So in the work that I've been doing with the collaborative on citizen data, we have two products we've been working on. The first really focuses on core approaches to qualitative citizen data, and the second looks at core methods to qualitative citizen data. And these go hand in hand. The core approaches have a little bit more to do with research design, and they're a little more abstract, whereas the methods are really the tools that are being implemented in each design. And so I wanted to spend a little bit of time going through the approaches, but I've also lost track of time. So if I'm running out of time, please let me know. So the core approaches we're looking at really starts with ethnography, which is the art of observation. And this can be a really beautiful method of embedding yourself within the communities, in order to observe what's happening, what that lived experience is. And this can involve observational methods, but doesn't exclude using other methods. So for example, it also often involves interviews and using documents and art and artifacts as well. But it's really about enmeshing oneself within that community in order to truly understand it. Then there's narrative inquiry, which is really embracing the power of storytelling, and allowing people to, this is especially powerful for communities and whose voices have been neglected and ignored for so long, to be able to have a space to share their stories and their experiences, and then to be listened to, and not only to be listened to, but to have those stories drive policy decisions that are going to be made. That's incredibly powerful. We also have participatory action research, or PAR, and this is actually a collection of a lot of different approaches and methods here, and it brings together participatory research with action research. So participatory research is, the population being studied, for lack of a better word, or that the community you're collecting data from being involved in the process, and there's varying levels of participation. So it can be they're just involved in one or two aspects, or they're completely involved in every single step along the way. And then the action component is you're doing something with that data. It's not simply staying on a computer or in a report. It makes its way back to the community in a way that's actually going to lead to action. And so this can be incredibly powerful when we're looking at policy advocacy and how community and citizen data is included in that advocacy. And there's also community-based PAR or CBPR. There's a number of different methods. I also sort of wanted to call out photo voice a little bit separately, even though technically it's a form of PAR, but it's one where you give community members cameras or video cameras. People know who uses video cameras these days. A way to take videos, whether it's on a cell phone or another method, but you give them a way to record their own lives in not only their own words, but also their own images and videos. And so that's another way of telling stories that can be incredibly powerful. But one of the things that I love about it is that, as a researcher, somebody that works with data, that embraces that storytelling as data itself. And it says, okay, how do we put this literally in people's hands? And then how can we use that as a mechanism for change? And then finally, there's case study, which I always refer to as the deep dive, because it's really looking at a couple of cases and then going very much in depth. And anytime you're doing a case study, really, you're going to be employing multiple methods in order to understand those cases. So it's going to probably include observation, interviews, documents, archival analysis, anything, pretty much anything you can get your hands on. And we're going to see some wonderful example of case studies later on in this webinar. And then some of the more specific methods, or rather these tools that we use in these different approaches, involve interviews, which are basically one-on-one conversations with people. I mean, at their core, that's what it is. What could be more engaging than that? Really understanding someone's experience in a rich way. And then focus groups, which are actually dynamic group conversations. Typically, you want to do a focus group when you feel you're going to get richer information if people have an opportunity to respond to others in the focus group and not just you one-on-one. And so those are a way to capture that dynamic conversation, because one of the things I love doing is focus group with youth, because they always tend to do better in a group where they can respond to and bounce off of each other. And you really see these conversations come alive, and you can learn so much from them. Of course, there's observation, but observation, you don't want to just be, like the person sitting back watching in a creepy way. It's really about getting involved in the community and learning from people in a variety of different capacities. And then there's a number of different ways that you can structure observation so that it doesn't seem weird and creepy and extractive. There are also narrative methods, so a lot of different ways that you can get people talking about their own experiences and capturing their own experiences beyond simply what you would get in an interview. And so different ways to engage people so that they feel more comfortable in sharing what they've been going through. And then, of course, there's a variety of digital methods, and these are growing every day, that can be utilized in order to engage communities so that you could get really rich citizen data that can help you in meeting the needs of the communities that you're working with, right? And so all of these things together really give you a very diverse toolbox of things to pull from. And we try to address how each can be done intersectionally in order to collect qualitative data so that it's going to enrich the job that you do, the problems that you're able to address, and the communities that you're serving, so that you're working together, honestly. So thank you so much for listening to me, and I'm looking forward to your questions later on.
Thank you so much, Kate. That was an amazing presentation. Not only did you cover a lot of the content that we have in the guidance on what we mean by qualitative data and how they can be produced and used, but also a lot to reflect on in terms of what concerns we have, all the ethical issues, all the risks and challenges that we faced when we talk about intersectionality. And it resonates because we got a lot of comments also when we shared the document, the first round of the consultation, exactly on those points, right? The danger in some cases of using intersectional data. And even to the point that there are instances when it should not be ethical to collect data at all. So there are so many important points that you raised, and I'm sure we'll hear comments and questions later on during the discussion. Thank you so much. But now let me turn to our next speaker, Lorne Farovich, who is the executive director of the Global Deaf Research Institute. And he will share a country case study from Ecuador, illustrating how intersectionality has been applied in practice. So very important to hear from you, Lorne, and you have the floor. Over to you.
Thank you so much, Francesca. I really appreciate it. Good morning, everyone. My name is Dr. Lauren Farovich. Sign name looks like this. I'm the Executive Director of Global Deaf Research Institute. The sign looks like this. It's two hands coming together. It's an organization that was founded for the reason of addressing essentially systematic barriers that are approaching deaf communities on a global level. So there's disability, which is one of the most diverse groups of people in the entire world. It includes essentially every marginalized group you can think of. So when you think of disability and you really go into the nuanced nature of what's involved in disability, there's a lot of complexity. So I'll explain a little bit why I founded the organization and kind of what our research focuses on. My organization, at the heart of it, is really primarily doing work for a national needs assessment. So I'll go ahead and pull up get my notes here. Recently, a national deaf needs assessment we did over in Ecuador. We did an deployment. Previous to that, we did a deployment in Nigeria. So I'll talk specifically about our experiences in Ecuador for the sake of this webinar, though. So we included deaf communities from all over the country on a national level. Within the country of Ecuador, we used mixed methods, both quantitative and qualitative data. For us to really fully understand deaf populations and their basic needs, the human rights that they deserve, is we have to first focus on the systems and what's barriers and being provided for that community. Because oftentimes what applies to them doesn't always apply to every marginal group. So when we think about the concept of looking at the systems of the country and what society, what beliefs are in place, the cultural implications, all of the services that are available, then we take that and how it applies to deaf populations and what's being excluded or included for that population group. We worked with several deaf leaders over the country of in Ecuador, identifying social comfort, for example, how certain populations or certain people groups in those specific areas understand the concept of just comfortability, the identity of who they are. First, it's important to get the information and then to actually share what the systematic barriers are. So the issues that we were seeing and what they face is their ability to actually get and understand information from various government entities. How it applies to deaf people is it seems like oftentimes they're looked at as it's just a hearing problem, but when you actually looked at how the diversity is involved within deaf people, there's 4 different types. And so it's not just your ability to hear whether you can or not, it's your ability to get the information and have access to what's happening. There's essentially 4 categories of deafness. One is someone who could maybe understand information and gain it orally, based on spoken language, someone who uses visual communications, such as sign language, deafblind, who uses tactile approaches, and then finally, language deprived, which is essentially people who have never received any sort of basic language in their primary age. So people who don't understand communication in general. No baseline, I should say. So essentially, we started with deaf identities first. We started trying to figure out what are some of the systematic designs that they're not able to access. And a lot of this applies to disability all over, but it really is important to get a nuanced perspective on what the deaf people are facing. Because you have, again, disability is so diverse. And then on top of that, you have the diversity that's involved in the deaf community, which is essentially very, very complex. So based on how the 4 types of deafness gain information, if you start from that foundation, then it will go into different identities. For example, if you are deaf and you are a woman, you're going to get information in a different way and you're going to have access to different services or lack of access to different services. If you are deaf and identify as LGBTQ, if you're deaf blind, it's important to understand that intersectionality is not something that is essentially that's added on. It's something that is an identity in coexistence with other identities. So there's intersectionality is something that coexists together and it's simultaneous. So we use something called matrix math to kind of show the visual representation of this data, how it's not actually, intersectionality is not just an addition of identities, but it's actually two things coexisting at the same time. So matrix math is essentially a visual way of solving some of the assessment complications that face different types of variables and different issues that come together. So you have essentially a matrix. So you might have 4, 5, 6, 7, and there's numbers associated with a line and a row. So you have a problem as a whole, comprehensive problem, and then you have each row, which represents a specific identity, and then you have each line item, which represents a further nuanced nature of that group. So, example, the third row might be woman, and then you have, or LGBTQ, whatever the case may be, and then you have the rows down, you have systems, so small systems within a big system. Another one might represent education, one might represent, fill in the blank. So essentially what the matrix math is showing is a visual representation of what some of those communities are happening and again, like how all of those communities are working together, not that it's an add-on to an identity, but rather that it's all these things coexisting at the same time. And having a matrix math helps you see that visually. For example, I identify myself as deaf, male, and gay. It's not, I can't be deaf today and then tomorrow identify as only gay. Like I am all of these things at the same time coexisting. And that's the same with everyone who obviously that we research, that we want to make sure that we're representing their identities in a way that is coexisting with each other. So I can essentially with the matrix math, I can see who we're not talking about the levels of oppression. This specific person experiences more oppression than not, but talking about more of how those identities coexist and how we can show them. So going back to Ecuador and the work that we did there. Let me pull this up, hold on one second. One of the big issues that we have been seeing with deaf communities and disabled communities as a whole is there's just not enough data. It's important to understand the struggles and the barriers and the basic needs that deaf people have. And in order to do that, we have to actually have accurate data collection processes in place. So when government collects data, typically, or it's on census is how they get most of the data within their specific country. Oftentimes, it's not nuanced enough to actually talk about the differences within, for example, people who use different languages, people who use different modes of communication, modalities. The assessment doesn't really cover that. So for us, we disaggregate that data to understand deaf women and what are they essentially, how is their access to healthcare, for example, how does that differ from deaf male access to healthcare, and what are the barriers that face some of these specific nuanced groups of people within the umbrella of deafness. So the goal for us is to really analyze the system and figure out what kind of services are being made available, and then take a look at on the ground deaf people and what they're actually facing. What kind of information do they have as far as deaf women? And how do we really aggregate that data in a way that's helpful and beneficial for the services that are going to be provided by government? So, for example, going back to talking about deaf women, like how do we learn about deaf women's experiences and how do we take that and then apply it to the services that the government wants to provide? So you can't actually just take deafness in general and then try to tell the government using that data to improve services, because deafness in general is not someone who just identifies as just deaf is going to have a little bit of a different experience than someone who identifies as deaf woman, as a deaf female. So our findings in Ecuador were actually very interesting. Deaf women, we saw a big issue with them as far as healthcare and rights to healthcare. Really, if you go down even further, it's just access to information. You also go to deaf people who identify as LGBTQ. The discrimination is there. You also have queer hearing organizations they're not able to access. Deaf individuals are not able to access because while they do identify as LGBTQ, they don't necessarily have access to communication to actually use the services offered by the organization. Then you have deaf indigenous populations, which are typically more remote and removed as far as geographically. And so when you have rural communities, they're even more removed from a lot of the information or systematic opportunities that could be available in a city. So there's oftentimes barriers to even getting access to information. Societally, it's hard to access the information that is coming out through in how like in videos or in media because they just don't have access to that in rural areas. All of the data that we found was very, very intuitive and interesting. But the next step is that we wanted some more intuitive data for each identity, each separate and nuanced identity. For example, when we use the matrix math, we would actually be able to identify what if an individual has this identity and this identity, where do they fall on the matrix? So after collecting that data, then we disseminated the information so you could get a comprehensive view of deaf people all over the country of Ecuador. Currently, we're looking for more funding to actually hire someone to really go into depth with each of the aspects of the matrix math to really disaggregate a lot of that data so that we can have more of a specific view of what each smaller population within the umbrella of deafness face. So we've learned a lot of lessons in working with deaf people in different countries. We've learned a lot of how to actually do it. There's sample size is huge. It can be a huge issue, but it can be because it can be very limited. The reason is it really show it qualitative data is incredibly important. So it's very powerful. And that's one of the things that we found that when you actually want to explore the more specific use cases, then that data of getting stories, of getting for example, it's very hard to find deaf women. They are out there, but how do we actually find just deaf women? That can be definitely difficult. How do we make sure that their voice is heard within all of the other data that we're collecting? So we want to make sure that we're weighting each identity equally. If we rely just on qualitative metrics or quantitative metrics, the weight of that information that we collect and the data is going to be very different. We're going to unfortunately not be able to have the input of, for instance, a deaf blind woman. So that's a continual problem, is making sure that we're looking at each identity and each spectrum of identity and making sure that we show that information in a way that's giving each voice weighted, because we want to make sure that the information, the data we're collecting is actually providing services then for the government to make sure to address the needs of their community and their constituents. Oftentimes we've met a lot of individuals who say that there's, a deaf person locked inside a basement. They've heard of them, a neighbor, a friend, a family. And, how do you get information from someone who's locked inside a basement? How are they even filling out a census? They're probably not. So getting data in a different and more unique ways is really important because you're getting stories that are otherwise not told. So for me, I'm really pushing advocacy for more power in collecting qualitative data in the deaf people and getting more of that nuanced story, not just the general quantitative. So overall, the concept of just barriers that global deaf populations face within different countries are something that we're continually working on and trying to improve the data collection of how we actually do that and then disseminate that information. So thank you so much.
Thank you so much, Lauren. That was incredibly interesting and helpful, I think, in trying to also understand how this can happen in practice, right? And concrete experiences. And especially, the experience of people with disability. We've dedicated, sorry, I forgot to turn on my camera. Okay, I'm here. We dedicated a lot of attention within this group and this work stream on intersectionality. I also want to mention that Elizabeth Lockwood worked with us at ODW on a report that specifically looks into intersectionality, specifically when it comes to people with disability and how those that intersect with other marginalizations and issues. So very, very important area of work. So it's now time to hear from you. We already have a couple of very good questions in the chat, but I would encourage you to keep, typing there and asking. And also, if you have inputs or issues that you think we haven't considered in the guidance material that we should cover. And Elizabeth has already mentioned the fact that we have the Google Doc where you can also insert your inputs. So the first question I see is about data extractivism and how we can mitigate the risk of data extractivism and if we have any practices, any best practices on how to do it. So maybe I go first to the panelist to answer, and then maybe I also want to add something. Elizabeth, should I start with you?
No, I think we can start. Let's start with the question.
Kate.
Yeah.
With Kate and perfect. Yeah. So let's give the panelists the first round. Kate, over to you.
Yeah, certainly. I think there's a lot of different methods and processes that can be used to mitigate data extractivism. I mean, one is to use participatory approaches, to use community-based approaches, also reflexivity, which is something that all researchers should use, is a very critical method of mitigating data extractivism. But I think the most powerful and effective method is to have those that you're collecting data from to lead the process. Leadership of the most impacted, really, and not just centering them in the process, but allowing them to guide the process itself is going to be the most efficient and effective way of ensuring that you're not going in with trying to just extract data and leave. That said, it does involve more investment of time, money, other resources. And so sometimes it may not be feasible, but wherever possible, that's going to be your best way of going forward. And, as I mentioned when I was talking about, participatory action research, or PAR, there's different levels of participation that you can do based on the needs of the question, the problem, the community you're working with. But making sure that you're doing it in a way that's appropriate to the problem that's being solved. And when I say appropriate, really, it also means the community should be telling you whether or not you're meeting the needs, right? That's really, I think, going to be the best way.
Thank you, Kate. Very good, interesting answer. Lauren, over to you.
Yeah. So wanted to answer two questions. The first one being, let me see. Within, wait, do it again. 1 second. Hold on 1 second, going back for the interpreter. So to answer two of the questions, I can kind of do two in one. So how is our data collected? And then how does that work within the government? And then that's the second one. And then the other one is basically how do we approach women within disability and how do we analyze them together? So we talk about the experience of going in. I'll talk about my experience specifically in Ecuador. So it's important for us, before we go into community, we essentially want to be invited. We want to just show up and essentially help out of nowhere. We want to make sure that we actually have a physical invitation and connect with the deaf community, the organization. And so in Ecuador, that's exactly what we did. We were invited by the national organization there in Ecuador. We also had connections within the government, disability department specifically, had conversations and developed relationships with both of those entities. So it was important to kind of essentially have stakeholders and start to kind of design a process together so that we're not just coming in and kind of taking over. So as far as the government side, they did work with us. We worked on the ground with the deaf organizations, and then the data that we collected, we then gave to the government so that we were able to essentially give them a baseline of what we got within, kind of the structures that we did, the information that we got, and had that documentation. We are still kind of going back and doing some comparison. So, for example, if the government is thinking that maybe this specific resource that is given is working, we go back to the community and ask if it actually is. We talk about abuse within deaf women. It's really important for us to connect with, again, like I have mentioned in my talk, with every nuanced group of people who identify as deaf. So that could be deaf persons who is in wheelchairs, just all of that. So like Kate was saying, one of the biggest concerns is tokenism. And that was an important thing that I know that you mentioned in your talk as well. And that causes a lot of problem within the deaf community. Oftentimes we think, oh, deaf women, they're a perfect, they're going to represent everything and all identities of what it means to be a deaf woman, when essentially that's not true. Like I talked about previously, deaf people have 4 different needs. For example, you have deaf people who speak, deaf people who sign, deaf people who are blind as well, and then language deprived. So it's important for us to actually have conversations with deaf women in the community as a whole, not just picking one to base an entire amount of resource on. So heavily recommend developing some type of community advisory board or working with like research so that you have strong tools to actually develop that. So I hope that kind of answers some of that question. I know that was a little bit exaggerated, but hopefully that answered the question.
No, that was a great answer. Elizabeth, anything you want to add to this?
No, I can add to the other questions.
Okay,
But
thank
you.
Thank you. No, I think that those were very, very good answers. I only want to mention one more aspect when it comes to data extractivism, and that is a very large amount of data that get extracted by private companies, and a lot of that is increasingly, being used, and even in some cases integrated into official statistics. So I think it's also a question of giving these communities and citizens agency so that they also have a bigger role in data governance and decision making, how data are used and what type of data get used. And also overall, it's a question of balance. The more we have the involvement of citizens and various communities in the data production, the more we can balance the other side, right? So it's overall, it comes down to governance and agency, I think. But yeah, very important, and thank you for raising the question, our participant. The next question is about integration. What steps we've been taking to integrate, this data into official government data, and any wins or challenges to share. I think we can talk about this for another whole webinar, but let me go back to Kate and Lauren first. Kate, over to you, and then Lauren, and then Elizabeth, if you want to add anything.
Oh, I don't think I'm the best one for this particular question.
Perfect. Yeah. Lauren, your experience.
And I'll have Beth speak for me now. So in order for us to work successfully with governments, we need to be connected to local organizations within that country first to show partnership. Through the local organizations, we can leverage their connections with the government, and that's what we can do. I have tried in the past to connect directly to government, and that has not been as effective. A big reason is because I'm American. I'm coming into a country, and so I am not a citizen of that government. But it could look different if you were a citizen of that country, of that government, and you are an active member of the community. You could maybe leverage your own network to connect to the government, but always go to the local organization to further strengthen that connection.
Thank you. Elizabeth, do you want to add anything to this? Yes.
Yes, I'd be happy to add to this. So in a lot of the work we've done, we find that this is a big challenge, but one way is to really start working with the local authorities and to start the process from the very beginning. So have a co-creation, co-production with the government. So to show that you're not replacing the data, but that you're complementing the data that already exists. And I think that's very important. We have excellent examples in places like Ghana, where the National Statistical Office is working with communities and really have produced these incredible results, filling data gaps. Also, building on what Lauren said, really working and ensuring that organizations, representative communities and organizations are part of the process from the very beginning, not as a token, but really meaningfully engaging throughout the whole process of the data value chain. And this is incredibly important. I can't emphasize this enough. And also, Anna Fe, I'm not sure if she's still on here, but she's running an organization of persons with disabilities locally in Las Piñas, Philippines. And what they have done is they collected disability themselves, data on persons with disabilities from Las Piñas, the city themselves, and then they showed this data to government officials, and then government officials saw, wow, okay, we see the gaps, we see the issues, and then now they are working together. So sometimes you have to start in reverse like this, and it works very well. So I just wanted to highlight those examples. Thank you.
Thank you, Elizabeth. Those are very good examples. And just to flag that also within the Collaborative on Citizen Data, we have established a new working group that deals specifically with integration of citizen data into official statistics. And we have countries, participants from national statistical offices, statisticians that lead the work. And they will bring together, the working group will bring together different parts of the collaborative, different representatives of civil society organizations and academia to identify the best approaches and also find, it's all related to establishing, data quality protocol and various ways to validate the data so that they can become part of the official statistical systems. But also, a lot of this data and a lot of these groups and communities do not want the data to be integrated into official statistics. So it's not always the case that, it's only good once it gets integrated into government official statistics. Sometimes those data have to be outside the official sort of boundaries and have to be used, and those groups want to use the data for other purposes and outside those boundaries. So, but a lot of work being done in that space too. Let's move to the next question. And I think this is for Kate about the meeting, the scheduling, the appointments for interviews that you mentioned. I think this is related to your core methods, but I confess I'm not totally clear on the question, Kate. I don't know if you've read it.
I don't know that I understand the question. If the person who wrote it wouldn't mind explaining a little bit more, I would be more than happy to answer it, even if it is by email at a later date.
Yeah, or in the chat. If you can specify exactly what you're referring to, and Kate can address it. Thank you. Another question for you, Kate, but I think can be addressed to other panelists as well, is about the AI and whether you think the AI is a bigger challenge than an opportunity for citizens, communities, and governments to get access to better and safe intersectional data. Kate, you want to start?
This is quite the loaded question, and I definitely have AI opinions, but I'm neither for nor against it because I think it really depends on how you use AI. I think also we've all been sold a lot of promises on what AI, and for those of you who don't know, AI is artificial intelligence, just going to state that so we're all on the same page. There's been a lot of promises made about the potential for AI, especially for the disability community. It's like, oh, it's going to help you in so many ways in your life. But some of those promises appear to not necessarily be possible or practicable. But also, there's a lot of potential harms that come with that as well. So I think that it could be good. It could also be bad. Right now, because we're not seeing regulation around AI, we're not seeing these ethics standards put into place in order to give guidance for how AI is being used. And to sort of piggyback off of something Francesca said earlier, we're also seeing a lot of data extractivism from private companies. Like, we all, when we get our phones or we get a new app or whatever, we scroll through the terms and conditions, this really long legal document, and we just click the agree button at the bottom. We don't know exactly what all we just agreed to, but we know that we can't get access to that without clicking the agree button, so we do it. But when we do that, we've given them permission to use our data in a variety of different ways, many of which we don't even know about. And so there's a lot of concerns about ethics violations, potential harms that can affect us and that are going to disproportionately impact multiply marginalized communities. And that's really concerning. So yeah, there's a lot of cool stuff about AI and a lot of things it can possibly do. There's a lot of lies we've been told that we'll see. It'll come out in the wash, but the harms are so concerning that that's where I think a lot of us need to be focusing right now. But that's just me. I'd love to hear what the other panelists think.
Thank you, Kate. I must say I agree with what you said, but let me turn to Lauren. Lauren, anything you would like to add on this point?
Thank you, Francesca. I do have two major concerns I'd like to raise. One is called digital divide, and this is a concept for those who have access to technology are separated from those who are without access to technology. And AI is just going to exacerbate that divide. It will make it more severe and it will separate people further. We've also seen that a lot of the AI technology that's being developed requires audio input. So spoken languages are being prioritized over signed languages when it comes to access to technology and to AI. Another concern I have is around a basic concept that is a part of AI. So AI needs data in order to function and in order to operate. Well, we are very aware that there is not that much data available. If anything, there's a scarcity of data around disability. So then how can that insufficient data make AI function the right way around disability? There won't be enough information for AI to understand disability. What that also means is that there's a lot of effort that needs to be done and work to be done around these intersectional identities and groups in order to feed into the AI for better data.
Yes. Yeah, how do we make those data AI ready so that they can feed into those algorithms and those models so that they can be used and so we have data that represent all of us. I want to flag also that, again, the collaborative is also working on AI and citizen data. We just started a research with experts that will provide a report soon, in about a month. So hopefully that report can also be the topic for another conversation so we can continue to dig deeper into these issues as they become increasingly so relevant and important and urgent. We need to address them urgently, of course, given the rapid growth of AI and AI use across the board. So, Elizabeth, anything you want to add on the AI issue or?
Very quickly, because I know we don't have a lot of time, with my work on accessibility, I just want to add that AI is very dangerous because it is, in some ways, because it is shown to be a cheaper way to provide access, when in reality, it's not going to be the same type of service. So we see this with automated captions and also one-way sign language communication with avatars, signing avatars, and we need to make sure there are two-way communication. This is very, very important, and a lot of times isn't considered. Thank you.
Thank you, Elizabeth. Yeah, that's a very important point to keep in mind. Okay, I think I'm continuing going through the questions. We have a lot. I hope we can address all of them before the end. One raises the issue that citizen data seems more challenging than it is nice to discuss theoretically. It is not well acknowledged by government agencies, which is true. We still see a lot of tension between the civil society and the public side, the National Statistical Offices in some settings. Also, how can we build substantial evidence data to really identify the left behind populations, build compelling cases so that no one is left behind? So how can we make use of what we've been doing so far so that we can build awareness and build better and more inclusive data systems, I think. Who wants to tackle this? The challenges. Who wants to go first? Kate, you want to?
I certainly can. I think that, yes, it sounds like more of a theoretical position than a practical one, but to be honest, it's actually really easy because what it means is just working with those communities, talking to those communities, listening. But that also means for a lot of people, unlearning some of the things that we've been taught about how we collect data, how we conduct research, and how we just operate in these data systems. And so once you sort of unlearn those things and then learn, really how you're situating yourself, how you're positioning yourself in that community, and that your role there is really just to listen to them, understand them, allow them to make meaning for themselves. And, it's really embodying your role as a tool, right? We often say we're just a tool to amplify those voices and experiences and perspectives. And then it's actually really easy.
Very positive and optimistic. Lauren, do you want to identify any challenges or ways forward?
I would. So what Kate just said was beautifully stated. Absolutely. We need to connect to the communities, develop relationships. And I want to also add that I think it's important for us to check our own privilege. I have to do that as a white man from the US. I recognize that I have power and I can use it actually for good to connect organizations to governments. And so that's what I'm trying to do, like when I was in Ecuador, because I saw that people were receptive to my words, my advice, because I'm a man who has a PhD from the US, whether that's for one of those reasons or all of those reasons, but using that privilege to connect government to deaf leaders and let them build relationships from there.
Very interesting. Elizabeth, you want to add anything?
No, I'm okay. Thanks.
Okay, thank you. So the next question is specifically on methods for improving disability or intersectional representation more broadly in existing population data sets. Is there any methods that look promising? From Jamie. Maybe Kate, well, I think all three of you have a lot of experience in this area. So I don't know who wants to start. Maybe we go the reverse order. Elizabeth, maybe you want to start?
I'm sorry, I lost the question. Can you, it disappeared. Can you ask it again or someone else can go?
Yeah, sure. Are there any methods for improving disability or in intersectional representation more broadly in existing population data sets?
We could have a whole webinar on this, and we have. It's a very complicated question and a very good question. I think the most important thing, we do have sets that we can use, and I think that's very important in censuses and surveys, such as the Washington Group questions on disability. But to go in more depth, we need to ensure that we have surveys that are specifically for persons with disabilities, looking at disability type, ensuring that everything is accessible. So in national sign languages and Braille and other formats. But we really need to include the qualitative data, like Kate mentioned, citizen data, to fill these gaps, because we find that there aren't not enough disability data being recognized, used, being shelved. So we need to use other data methods, administrative data, and so forth. And I will stop here. Thank you.
Thank you, Elizabeth. Lauren?
Again, like Liz says, it is quite complicated and there's no singular approach that will work. It's always situational. Sometimes it's that you can speak directly to the community. Maybe sometimes it's that it's an evaluation. At times it couldn't be that you can work with the government census data office. I will say that the best way to address this is to ask yourself what problem or what question you want to address, identify that clearly, and then bring it to the community to move forward.
Thank you. Kate?
And I can keep mine really short and sweet. And I mean, at the end of the day, it's putting a bit of a Band-Aid on the issue, on the problem, unless you're willing to actually, collect better data. What you can do is disaggregate the data and make it publicly available. And publicly available means to the public in understandable and accessible formats so that people can actually access their own data. Yeah, very importantly, disaggregating it. And that's not done nearly to the degree it needs to be done, nor made publicly available.
Thank you, Kate. And I think there is one more question for you specifically, Kate, on what approaches are used to sample respondents for the photo voice and video voice to address representativeness in the studies.
Yeah, I mean, there's a whole bunch of sampling methods. There's entire books on sampling methods, so I worry that might be a little too in the weeds for everybody else on this webinar. However, I would recommend definitely looking through the materials that the collaborative we put together, but also there's references in those materials for more information. But there's a whole section on sampling strategies. So I'm going to sidestep that one a little bit.
Okay, sounds good. There is also a follow-up from Jamie on the question around the quantitative data sets that maybe it's a bit more technical. You can answer on the chat, either Elizabeth or Kate or Lauren. And we have about 10 minutes left. But I want to ask my own question especially to Kate and Lauren, since Elizabeth and I have already worked extensively on the guidance. But I want to ask you how you see this work going forward and what you would like the collaborative to do, especially on this work stream, right? In terms of making what we have the guidance doesn't really offer a very practical sort of step-by-step toolkit, so it's not applicable immediately. I would like to pick your brain on how you see this moving forward. How can we really translate this into something that can be used, especially you, Lauren. You, Kate, have a lot of experience from the research side. Lauren, you have a lot of experience, on the ground. And how you see this and what would be useful and really impactful from your point of view, and what can the collaborative do over the next few months and years. So, Kate, you want to go first?
Oh, I was actually really looking forward to hearing from Lauren first, if that's okay.
Okay, Lauren first then, yes.
All right, just getting that cue. Thank you. So this is something that I've been thinking a lot about recently, being a researcher for 12 years or something like that. Wow, that actually feels longer than I realize. It makes me feel old. So, what I've seen in those 12 years is that oftentimes researchers have this perspective around research and asking what the research means and asking themselves what it means to collect the data from the research and publish. But that's not where it ends. Actually, that's only 50% of the work. What remains is sharing the information, dispersing the information, educating on that information. That's the important part, especially now in this era of misinformation where we see a lot of false information. It's important for us to take on that responsibility as researchers to disseminate the information in our research findings in as many modes as possible. So to make it available in layman's terms, scientific terms, governmentese, right? Make it social media friendly, obviously publish, have it in blogs and articles and vlogs so that we can sign the information via video. So that's the other half of the work that remains. And by doing that, you can build relationships with organizations. So I am a researcher who focuses on deaf questions. I've been finding a lot of data around deaf women. Well, I need to ensure that that information I find around deaf women are shared to women's organizations because oftentimes disabled women are not represented in those general organizations. And so I can make that connection.
Very, very important. Kate?
Yeah, I think I'll agree with everything that Lauren just said or signed rather, because you've developed this wonderful framework and all of these materials that have been developed. So then the next step is really implementing it and then making sure that you're not just translating that to the community, but you're also getting feedback, which of course is what you're trying to do today. But then it's how are you going to implement that feedback? And I know we've sort of talked about there might be a need to do trainings with NSOs, but also trainings with community members, with citizen researchers who are going to be involved in this so that they then have access to understanding these processes themselves. And also so they're empowered to collect their own data in their own communities, whether or not it's part of a national effort, right? It's just so that they have the skills then to learn about and understand what's happening in their own communities and use that data in ways that are going to benefit their communities. And so then also, of course, giving people multiple formats and opportunities to give feedback as they're starting to use these things to figure out what's actually working and what's not working. Where do we need more information? Where is there maybe a misfit? Because, sometimes things sound good, but then when you actually try to use them in the community, you find out that they're just not working for whatever reason. So I think that's really the critical, moment that this initiative is at right now, is my impression. And then, sorry, one thing I'll also say, although we've had all these conversations, so I know none of it's new information, but I think the other element that we've been sort of puzzling through is in the Copenhagen framework, how exactly does participation fit in, and how does it align with all of the elements of the framework to make sure that that's clearer, especially within the scope of collecting citizen data is, I think, going to be critical.
Absolutely. Yes, Lauren.
Thank you. I would like to add to Kate's comment around the connection to community. That's something that I have seen as a big problem. Oftentimes, there are researchers who will go into a community, collect data, and then they leave without ever sharing the results back to the community. What happens is the community loses trust in researchers and then are resistant to any future researchers that want to come in. And this is a problem. I did the national needs assessment in Ecuador for the deaf population. And what I did is after the national deaf needs assessment, I did interviews, I collected surveys, and instantly after that, I worked with the National Deaf Organization and some other service organizations, encouraging them to host town halls and train one of the deaf leaders of the deaf organization to become familiar with the findings so that way they themselves could present my findings and the findings of the National Deaf Needs Survey. And so it has multiple benefits. You build trust with the community understands the data that has been collected from them better. A learning that I will share is when it comes to data literacy and the ability for people to understand the data is a challenge. And so what we've learned is to maybe try something different. The next time we do something, we hope to increase trainings around how to teach the community how to leverage that data and the findings into their own work.
Great, thank you. Thank you. We have just a few minutes left, but Elizabeth, is there anything you would like to add to this discussion?
Just one, oops, just 1 minute to add on what both Lauren and Kate said, that we have found with data literacy trainings for organizations of persons with disabilities, that has helped tremendously. And we have tools, if anyone's interested, happy to share those workshop materials, and also awareness training for national statistical offices on accessibility, on disability. We find when this is done, the prevalence of persons with disabilities increases. So both are very important, I'll add. Thank you.
Thank you so much. And I just want to flag that there are some participants who are asking for your information and to know, more about your work on intersectionality in the disability sector. And if you want to share the information, but the webinar will be recorded is being recorded, and the link will be shared. As I said in the beginning, we can also share some more. We'll talk to Kate and Lauren, see how much they want to share. I'm sure they're happy to share their work and their information related to their research. So stay tuned. And we share Kate's presentation. There was a request earlier, and Kate has already made her presentation available. Thank you so much, Kate. It was beautiful, and I love the flowers. And congrats for the move to UCLA. And so it's time to close. I don't even try to summarize. I think we have unpacked so many of the elements that are covered, and more, a lot more than even what we cover in the guidance material. But just to say that, we have highlighted, I think, how complex this work is. We're just at the beginning, and there are a lot of challenges. There are incredible opportunities to really give agencies to citizens and communities, but there are huge challenges. So I'm really hoping we can continue to work together. We rely on all of you. This community is a fantastic community. We see that through the collaborative. So we really rely on your inputs and contributions so that we can learn from your experiences and translate those experiences into materials that can be useful to advance this agenda and to advance and make data systems more inclusive. And as Kate was saying, we want to count everybody. Data have to be representative, and people have to count. So that's terribly important. So stay tuned. But last reminder, please look at the Google Doc that we shared. And if you have any inputs, comments, or just you want to flag something that we missed that is really terrible that we missed and that should be covered, we'll make sure that we can address that in the revised version of the document, which will then be made available on the collaborative website. I don't know if we share the link to the collaborative website. Maybe we can do that really quickly, Raquel, in the chat, so that people can go and access documents there and learn about our events, our webinars, and the material we normally share there. Yes, it's there. Thank you so much, Raquel. Okay, well, thank you so much to our fantastic panelists, Kate, Lauren, Elizabeth. This has been incredibly interesting. Thank you for all your work. And thanks so much to all participants. And I hope you all have a good rest of the day. Bye.